Well, Kay Green with Roosevelt General Hospital in Portales and Derek Cuenca with Mountain View Regional Medical Center. Thanks to you both for making time. I know you're extremely busy in what is just a crazy time for us all.
Thank you. Appreciate the opportunity.
You're welcome. It's my pleasure.
Thanks, Kay. Well, let's start with you. As we look at your part of the state, no one is untouched by this, but it seems like things are going fairly well out there. Explain to me sort of how your hospital is adapting to what you're seeing.
Sure. I think we early on tried to prepare as much as we possibly could. We're a small 24-bed community hospital in Portales. We have a 4-bed ICU. So, we kind of scanned what was happening and tried to prepare ourselves with PPE and with additional ventilators, I think, as most hospitals did. We're very thankful that we haven't been hit yet like many other communities have.
Have you been pushed towards your capacity in terms of either ICU beds or ventilators?
We have not to date. In fact, early on, part of our planning was to stand up a 4-bed unit at the back. We just have one inpatient unit, 4 beds at the back, and we isolated those beds to create an additional kind of an isolation area. So we created an ante-room space for donning and doffing of PPE of our staff. And we put inpatients back there, but everyone we've suspected with COVID so far, their test has come back negative. So we've really not been pushed, but we've tested what we have operationalized in preparation.
And Derek, I apologize for the sound in the background, but Doña Ana County was a little bit late to the game in terms of its rush to, or its crush of cases. Describe what's happening down there in Las Cruces.
Actually, we do have cases here in our county. I think it's numbers up to about 80 or so. I wouldn't say we're late to the game. We were paying attention to what was going on the northern part of our state, but also around the country to some degree. I mean, we stood up our incident command center and our emergency operations as a hospital. And I should say that our competing facility in our community also stood up their emergency operations protocols as about 8 weeks ago. So very early on, before things even really, we saw anything here in Las Cruces. With that allowed us to prepare, take a very proactive stance in terms of what we were doing and how we were going to plan for surge. If it ever did happen in Las Cruces, we still have not seen a surge in our community. I have 23 ICU beds with vent capability for all of them, and then we have the ability to stand up another 21 ICU beds in our surge planning. That already existed. We already planned for stuff like that and practice it and drill for it on a regular basis. But we've never come close to actually hitting our capacity for our ICU, despite being the winter months where you would typically expect us to be running around 85-90%. We typically have been running somewhere in the neighborhood of about 60%. And we've only had 3 COVID patients here in our facility, and only 2 at any given time. So right now we have 1, and things are pretty smooth. Again, I think the proactive planning and standing up our operations very early on, 8 weeks ago at this point, it helped us prepare for that. But we really just never saw the surge that sort of the early modeling suggested.
Of course, you're both still hospitals and medical centers. When you look to order things like personal protective equipment for doctors and nurses, what are you seeing? Kay, let's start with you.
We are seeing tremendous shortages through our traditional supply chains. In fact, in New Mexico, we have a rural hospital network, which we're a part of. And through our rural hospital network, we were able to identify an alternate chain, actually through China, to get surgical masks and KN95 masks. And we simply couldn't get them through our traditional supply chain. So we've had to exercise that option twice now. We are now starting to get some supplies in through our regular chains, just as recent as within the past 2 weeks, but it was very difficult early on.
Derek, how about down in Las Cruces?
reiterate, along with Kay saying, our traditional supply chains as it related to specific PPE, particularly N95 masks, those became very challenging early on. We recognized that, like I said, 8 weeks ago when we stood up, and about 2 weeks into standing up, we started seeing the difficulties in getting those masks, our typical orders and PAR levels, maintaining our PAR levels early on. Fortunately, how Kay's part of a rural hospital association that helps leverage their buying power. Mountain View is part of a larger company, and it has about 90 hospitals, and so our company's it's been beneficial to help leverage some of that to help us maintain our PAR levels in stock. That said, I'm sure Kay's done this too. We've implemented some policies and procedures to reduce the burn rates of those PPEs, preserve them, to some extent put them under lock and key to make sure that we had them available for the staff and the medical staff that need them when they need them, but to make sure that they weren't just being overly used unnecessarily. So those procedures that we put in place early helped us maintain the PPE and keep us from barely being negatively impacted.
Okay. As we all know, hospitals are businesses. I would assume this is or can impact you in a couple of ways. If you do have people working a lot of hours, they can get tired. But also on the other side, if you don't have things like elective surgeries, that sort of thing, it can sort of start to feel maybe a little bit otherworldly. What are you seeing?
I think you hit the nail on the head there. I mean, people ask me how things are going, and I'm like, I don't think I've ever worked so hard for being so slow as a healthcare system. We're constantly working and trying to mitigate and plan and do processes and provide policy based on CDC, CMS guidance and what's happening. But the reality is we're not seeing the surge. We're not seeing a lot of patients. We're actually slower than we ever have been. Our volumes in our ER alone are down 45%. In both of our emergency rooms, surgery is down 75%. Our inpatient admissions are down 45%. So there's a tremendous amount of work that's not happening that typically happens in our healthcare system and in the community in terms of taking care of patients. So with that, our staff aren't necessarily overworked. They're actually asking for more work, and we're struggling to find the work to keep them busy. And keep them working. So we have a lot of folks that have volunteered to flex off, and we have a lot of job sharing and job sharing roles that people are doing. People have volunteered to be furloughed and some of those things. But our revenues, our revenue in this essence has been cut by 45% at this point. So it's created a significant amount of economic financial struggle because our overhead's so significant and so high. Our fixed cost as a health system is just tremendous.
Sure. Kay, I see a lot of head nodding there. Tell me what's going on there. And also, how do you communicate that to the state, what you're seeing, while also recognizing that, across the state from you in places like Gallup and up in Farmington, the picture is quite different.
Sure. Like Derek mentioned, we saw our workload significantly start to drop probably the third week in March. So because there's a lag time when we collect what we bill for, we didn't really see a big impact on our cash flow until the first week in April. One of the things here, we've got an attached rural health clinic, 14 provider clinic to our hospital. And we saw our visits in our rural health clinic down by about 65% by the last week in March. So we very quickly, in under a week, were able to stand up a telehealth program, which we had never offered through our system before. So our providers jumped on board. We found an inexpensive technology platform to allow us to do this. And I think it's been really well received in our community. And they appreciate not having to come in and expose themselves potentially. Like Derek said, our surgery, because we're a small rural hospital, most of what we do is not very complex and would be considered non-essential. So our surgery is down by about 98%. And that's your revenue generator if you're a hospital. So we really saw our cash on hand being rapidly depleted in the month of April. And we had worked really hard the past 2 years to get to a good financial position. And for me, that's just a positive 3% margin. So 3% is not very much. And when you don't have that income coming in, it's depleted rapidly. Now, one of the things we did, we were very proactive and we applied for a small business loan or grant through Small Business Administration because we have less than 500 employees here. And we didn't get approved the first round, but we did get approval this week. So that was a huge weight off of my shoulders because we had been asking for employees to voluntarily furlough or give up days without pay. And so I think probably within the next couple of weeks, once our loan is funded, we'll be able to put everyone back to work to the degree they were previously.
Okay. How does this change how you'll operate going forward? Maybe not necessarily in the near term, Kay, but when we look to next year or after there's a vaccine, do you anticipate doing things differently?
I do. I think this is creating a new norm across the board in our country, and hospitals are not excluded from that. I think we'll be much more prepared. I think we will increase our caches of things like PPE. I think we will likely order another couple of ventilators when we have the opportunity to do that. We had ordered 4 ventilators at the onset of COVID, seeing this coming, and all 4 of those ventilators got rerouted to other locations. So we've since got 2 of them in, but it will make us really look at how prepared we are for a pandemic in the future, because I do not think this is the last one we're going to see.
Yeah, I think you're right. Unfortunately, Derek, you said you're part of a much larger medical group with 90 or so hospitals or medical centers. How does this change what you'll do going forward?
I think I get asked, like, what does normal look like going forward? And I don't think normal is normal anymore. We're going to redefine what we look like as health systems and as hospitals. I think we're going to see universal masking in facilities. Some testing, of course. As testing becomes more available, rapid testing protocols, procedures, much as we do flu test. And of course, if there is a vaccine one day, and if the science proves out on that, it's like maybe even requirements or high recommendations that our staff get the vaccine if they're going to work in a healthcare setting to protect patients and to protect other staff members, since healthcare professionals are high risk for exposure to things like this. So I think universally it's going to change the way we look as health systems, look and feel, even with visitation. Allowing how many visitors we allow in hospitals and how many visitors we allow in patient beds or in the facility at any given time, especially if the social distancing continues to increase or continues to be part of the process in which we deal with this. So yeah, it's going to change the way we look. In addition, I think that volumes aren't, as health systems, I think volumes aren't necessarily going to return immediate. For ER volume to be cut in half, essentially, at least in my facility, and from what I'm told from other colleagues, and they're experiencing the exact same thing. You might see less people utilizing the emergency room and a lot more people using telemedicine. I think telemedicine is here to stay. That's going to be used considerably going forward for some of the things that some people probably used the ER for in the past, or urgent care settings. So they're going to try to protect themselves by isolating, self-distancing, but still getting that medical care through technology.
Sure, that's something that can work fairly well here in New Mexico. The things that obviously can't wait are the things like heart attacks and strokes, where time is of the essence. We just have about a minute left or so. Can you quickly describe, are you seeing people staying out of the ER too long before they come in?
I think it's anecdotal at this point, but it seems to feel that way when I talk to my ER providers. It's like this person, they've been experiencing this for a couple of days when probably normally maybe they would have come in day 1, not day 2, or they would have come in the first hour, not the 6th hour. It's very anecdotal right now, so we certainly haven't put any real math behind it, but anecdotally, that's what I'm hearing from our ER providers, that it seems that people are delaying coming to the hospital or going to see their doctor. That's certainly concerning. I think we're going to see some health outcomes 6-7 months, a year from now because of some of the delays that people are doing now. We might actually see some negative health outcomes down the road as a result of this situation we're in right now and the decisions patients are making.
Okay, well, I want to thank you both for making time this afternoon. Like I said, we know that you're busy, but it's reassuring to know that that both of your facilities are prepared, and if people do have emergencies and a reason to go in, that they can go in and not be frightened. So thanks so much for your time.
Thank you, Matt.
Thank you. Appreciate the time.